This is Vagitem. That's the estrogen suppository that I was talking to you about. There are lubricants. We at the Center for Sexual Health recommend that people use lubricants that are water-based, water-soluble, because if they are not water-soluble, they can carry infection into the urethra, and people can have urinary tract infections or bladder infections, and that's not a very good thing. I remember one time talking in a breast cancer support group, and one of the women talked about using olive oil as a lubricant. And I thought, what a cool natural lubricant. Isn't that a great thing? Well, speak to the urologic nurses or the urologists, and they all say, no, that anything that's not water soluble is not a good lubricant for general health. So water soluble, that's one thing. The other thing is lubricants that do not have glycerin, because some of them do. And so for anybody who might be pre-diabetic, or their partner is or is diabetic, that's not a healthy lubricant to use. So water soluble, non-glycerin. Astroglide is actually one that a lot of people like. Oh, okay, so here we go. Here are the dilators that are of progressive sizes that can be used to keep vaginas open. Vibrators, also good. Now this is something that is relatively new, but actually there has been some research even done with scleral pumps. So this scleral pump does two things. It serves as a vibrator, so that one can sort of move it around the perineum and stimulate blood flow with it. And then it can act to stimulate, then it can be placed onto the clitoris and pumped, create a vacuum, and the vacuum will bring blood into the clitoris and make it sort of ready for sexual stimulation. And it is something that has actually contributed to better sexual satisfaction of women. Somebody's done a study on this, that it has contributed to better sexual stimulation in women after cancer treatment. Okay, now what is there for men? This is something that we use after prostate cancer. This is called the prelude, and it's like the beginnings of working on developing erections again after the treatment. It's a plastic cylinder that goes over the penis. You create a vacuum. The vacuum brings blood into the penis. You gently pump it, and it creates a soft erection. So it's a way of stretching. We were talking about the dilators for stretching the vaginal tissues. This is for stretching penile tissues. Vacuum pumps are actually tools that can be used to create erections for men who are unable to have them otherwise. Basically, again, this cylinder goes over the penis. You pump out the air pulls the penis into an erection. Then you put on top this cone and put a ring over the pump onto the base of the penis to hold the erection, and then you remove the pump, and the man is ready for intercourse. It's a very effective tool. As I show here, there's been some research done on this. It's 90+% effective, and if men can get over the mechanical nature of it, it's very, very good. In fact, in prostate cancer, that's one of the things that men really are unhappy about, because it's so mechanical and so, I don't know, you don't want to do that kind of work while you're trying to have sex with a partner. But not so long ago, I saw a man who was an engineer, and when I told him about all the options for erections, he said, oh, I know how this works. And he was just dying to get it and try to see how he was going to figure it out. So that was a blessing for his partner, actually, because if he was not going to be turned off by it, they were going to incorporate it into their sexual activities. These are sleeves that can go, you see these rings? Sometimes they can be kind of harsh on the base of the penis. So one of our local medical supplies companies invented something called penile rings that can go on the base of the penis, so that when the ring comes down, it goes on this rather than on the skin. There are penile injections that go into the bottom you know, bottom of the penis. No, not by the bottom of the base of the penis. They are very tiny injections. They are sort of like diabetic injections, and you know, people rotate site so that there's no scar tissue developed, and they can create an erection in half an hour and keep it for half an hour. People who have heart problems are recommended not to use them, and usually what we do in urology, people come to us for this kind of help. We have a nurse instruct. It's something that we don't just send home with people. And this, and you see up here that it's about 80% effective. And this is the same medication used with a little plunger, like it's a suppository that is used with a little plunger that goes into the urethra. It really is very tiny. And again, it has to be taught by a provider. For men who are fed up with using these kinds of treatments and are not able to have spontaneous erections, there are penile implants, which are typically liked by the people who have them, but there is a risk of infection, and once you use an implant, you can't go back to any of the other methods. So it's usually a treatment of last resort for people. So these are two shafts that go into spongy tissue that are filled with saline, with water. The water is kept in a reservoir, and there's a little pump that can pump it in for an erection. And these are more like bendable shafts that are in the penis that can be manually stretched. So there are all these things that people can do to get back to sexual functioning if there has been this kind of an effect from either chemotherapy or radiation that causes difficulty with intercourse and difficulty with intimacy. But those are the mechanical things. You know, there are also the psychological aspects which are no less important. And so very often after people have been treated, they come and tell us, you know, I'm really scared about resuming sex because I don't know how it's going to work. I don't know how I'm going to work, how I'm going to feel, whether it's going to be good. And so it's important to start really, really slowly. In that context, and if there are partners here, partner reaction is like the #1 factor in success. If partners can be patient, loving, supportive, and accepting, that makes all the difference in the world.